Dr. Joe. I am a medical doctor and a lifestyle medicine expert with special interest in natural reversal of high blood pressure. So here's the thing. Pharmaceutical companies should not make mistakes, but the fact of the matter is they do. In fact, there have been quite a number of drug recalls, drug alerts in the last couple of years. So, the question we're going to be tackling in this very video, rather, the topic we're going to be talking about is a latest high blood pressure medication recall, okay? High blood pressure medication recall. There is one that is ongoing at the moment, and you need to know about it. So, how about we check out the details of this latest alert and recall? Let's go check it out. So here we are on the gov.uk website, and in here there is a press release, and it says patients urged to check packs of blood pressure medicine lecanidipine after labeling error. And they're talking about the medication that is affected, which is 20 milligram dosage, but in actual fact it is the 10 milligram. And why do I say that? Well, here it is, because this is the real reason why the recall is taking place. And here it is. It says the packs are incorrectly labeled as 10 milligrams on some sides of the pack when they are 20 milligram tablets, meaning the tablet you've got in your hand that you thought was 10 milligram is actually 20 milligrams. Meaning when you take this very tablet, you are unwittingly overdosing yourself. Okay, you are overdosing yourself. So they've given some instructions then. What should you do? Here are the instructions for patients who have been prescribed the 10 milligram tablet. And indeed, this is the one that is relevant because this is the one that has been mislabeled, the 10 milligram tablet. What should they do? Well, here is what they're saying. They're saying that patients prescribed 10 milligram tablets and have received tablets with this batch number should contact their pharmacist or general practitioner immediately. And they've also gone ahead to say, if the general practitioner or pharmacist cannot be reached, patients should call NHS 111 for advice on continuing their medication. And then it goes further to say, if patients cannot speak to a healthcare professional before they are due to take their next dose, they should, and they've given 4 instructions on what to do here. 4 instructions. So instruction number 1, well, patients should verify the strength of the tablets is 20 milligrams from the information on the foil of the blister strip. Instruction number 2, remove 1 tablet from the blister as normal. Instruction number 3, locate the break line on the tablet. And having located the break line of the tablet, what should you do? And that is instruction number 4. You should then snap the tablet in half across the break line and take half of the tablet. So, they're also saying that this is a temporary measure until you can talk to your pharmacist or doctor. So that's what you should do. There are instructions for the 20 milligram tablet, but they're not really affected. It's the 10 milligram that has been mislabeled. So Dr. Alison Cave, who is the Chief Safety Officer for MHRA, has said this. She says, patient safety is our top priority. We ask patients to check their medicine packaging and follow our advice. She goes on further to say that healthcare professionals such as pharmacists are also being asked to stop supplying medicine from the affected batch and to return it to the supplier. And this next statement is for us doctors. If we suspect any adverse reactions, then of course we have to do the needful, which is report to MHRA using the yellow card scheme. That is what we normally do. The manufacturer is one who has issued this very alert,
Recordati Pharmaceuticals Limited, they are the ones that have made this very blunder. So there you go. This is the instructions. Oh, by the way, the most important thing to note is that you really have to check the medication that you've got with you, because you want to know what the batch number is. So the batch number is MD4L07 with an expiry date of January 2028. So please check your batch number to verify that you've got this very medication. If you've got this batch, then of course you know what to do. The instructions are already outlined.
Okay, so just as a reminder, the medication affected this time around is lecanidipine, and the batch number is MD4L07. So please check the medication that you've got with you at home. If you have been prescribed lecanidipine, which is a calcium channel blocker, if you got that, check the batch to see if the medication you've got with you at home is affected, in which case, please do as instructed. So, these drug blunders, they are happening quite often these days, much more frequently than we would like. 2 years ago, there was a similar one that affected another medication called quinapril. That is an ACE inhibitor. It's also a blood pressure medication. And at the time, the quinapril was contaminated with a chemical that potentially could cause cancer. It was nitroso-amine contamination at the time. And all the batch of the quinapril affected then had to be recalled. So here we are again. We are dealing with another one. This is lecanidipine. 2 years later, we are dealing with this now. This is mislabeling. So in this instance, the medication in your hand that you thought was 10 milligram is actually 20 milligram. Meaning if you take it, you will be overdosing yourself. And the consequences, like I said before, can be telling. Because what's going to happen? Well, the side effects will be exaggerated, okay? The side effects of this medication, this lecanidipine. So things like headache, you'll have terrible headache, severe headache. You're going to be well flushed in the face. And you could have edema of the legs, okay? Swelling of the legs. And you could end up with terrible palpitations. And then, of course, your blood pressure could drop quite low, in which case you feel giddy. And then you could have a fall, especially in the elderly. So this is the kind of thing that can happen when an error like this happens at the level of the factory. So quality assurance is a problem for pharmaceutical companies. Anyway, I thought I'd let you guys know about this latest alert. Hopefully you got some value from this very video. If you liked the video, please give the video a thumbs up. This channel is new. If you liked this very video, you should subscribe, especially if you've got high blood pressure, because I've got more videos to come in the future. We're going to have a lot of fun in this very channel. So do subscribe, and I'll see you guys next time. This is Dr. Joe signing out.